There are some significant medical conditions directly related to pregnancy and childbirth that may affect women. These include urinary and fecal incontinence and prolapse of the pelvic organs. The underlying cause of these conditions is the injury or weakening of the muscles and ligaments supporting the pelvic organs. There are two significant but rather frequent events that can make the pelvic floor muscles weakened: pregnancy and delivery. In addition, the likelihood of injury increases with age. Women who give birth later in their life are more at risk. This graph shows the close relationship between pregnancy or delivery and incontinence. The first delivery more than doubles the risk of incontinence. After consequent births, the complaints often get worse. This can be attributed to the fact that pelvic muscles have not regenerated properly after previous deliveries. The regeneration of pelvic floor muscles is a natural process that starts right after giving birth and lasts for about 12 months. This is a unique healing period of the female body which never returns. It is therefore essential that we make every effort to assist in the regeneration. Regular pelvic floor exercises started during pregnancy and continued after delivery can strengthen pelvic floor muscles and increase their resistance. Also, some nutrients play a particularly important role in the regeneration of pelvic muscles based on recent research. These include leucine, an essential amino acid, omega-3 fatty acids, and zinc, the second most common trace mineral in the human body. To improve recovery after delivery, a specially formulated postpartum supplement, Mommy 2, was created based on years of research. The effectiveness of Mommy 2 has been tested during a randomized, double-blind clinical trial at the University of Debrecen in Hungary in 2018. Based on the research results, the use of Mommy 2 has significantly improved the postpartum regeneration of pelvic floor muscles. Women in the treatment group taking Mommy 2 had a lower chance of bladder prolapse and complained much less about having a loose vagina, a condition that has a negative effect on the quality of sex life. Weak pelvic floor muscle strength, measured by Peritron perineometer, was significantly less frequent in the treatment group compared to the control group at 6 weeks after delivery. Unilateral levator avulsion, which is a good indicator of a levator muscle injury, was significantly less frequent in the treatment group, women taking Mommy 2, compared to the control group at 6 weeks after delivery. Anterior vaginal wall prolapse at or beyond the hymenal ring was significantly less frequent in the group of women taking Mommy 2 compared to the control group. In the postpartum period, it is often difficult to pay attention to proper nutrition. Mommy 2 food supplement contains all the nutrients and trace elements the mother needs for regeneration, breastfeeding, as well as what the baby needs for development. For more information, please visit mommy2vitamin.com.